Hello, today I'm going to talk about blood clots and what you can do to prevent them from happening to you. Blood clots can arise anywhere in your body, in arteries and veins. Deep vein thrombosis, or DVT, is a blood clot in the leg, and thrombosis is a clot. In this video, I'll discuss clots in the leg and lungs. When a clot breaks off from a vein in the leg and travels through the body to the lungs, it's called a pulmonary embolism, or PE. In the United States, every 6 minutes, someone dies from a blood clot. Blood clots kill 100,000 patients per year. Blood clots found in the leg can form in superficial or deep veins. Blood clots can arise from anywhere in the body, and that includes arteries and veins. It's preventable and treatable if discovered earlier. A clot in the lung travels from another location, and it's usually the leg. This is a serious, life-threatening complication that can be fatal. Prevention is the key. Risk factors for blood clots include inactivity, smoking, pregnancy, overweight or obesity, 60 years of age or older, heart disease or elevated triglycerides, lung disease, trauma such as fractures or automobile accidents, recent surgery, especially orthopedic surgery of the hip and knee. Other risk factors include previous blood clot, prolonged travel in a car, train, bus, or plane, hormone replacement therapy, diabetes, severe illness, cancer and cancer treatments, blood disorders, and autoimmune disorders. Signs and symptoms of a blood clot in the leg include tenderness, swelling, and it's usually in one leg, redness, pain in the leg, and feels like a cramp, and the skin feels warm. Signs and symptoms of a blood clot in the lung include unexpected shortness of breath or difficulty breathing. Your breathing changes dramatically. You may have chest pain with deep breaths, anxiety, sweating, coughing up blood, new onset cough, increased heart rate. You just don't feel like yourself. Sudden feeling you might die. See your doctor immediately if you have signs and symptoms of a blood clot, or go to the emergency room if you have trouble breathing. There are different tests that can be ordered by your healthcare provider to determine if you have a blood clot. D-dimer is a blood test which can help tell you if you have a blood clot in your body. This test is not as specific as an ultrasound. If your healthcare provider thinks you may have a blood clot in your leg, they'll order a duplex ultrasound. They can see if the blood is flowing normally. The ultrasound will show if the vein is obstructed, and if so, it might be a clot. If your healthcare provider thinks you have a blood clot in the lung, they will order a CT scan or a CT angiogram. They can look at the blood vessels within the lungs and see if there's a clot in one of the vessels. Here are some ways to prevent blood clots. Walking. Walking is very important. When you walk, your blood does not sit still long enough to clot. Get up and walk every 2 to 3 hours during the day. If you can't walk, do leg exercises in bed or a chair. Sequential compression devices can be used if you're bedridden. It is a mechanical device for your lower legs. They massage your legs to keep the blood flowing. It's important to keep these on if you're bedridden. You can also consider wearing compression or TED hose. These also help with blood flow. Your healthcare provider may prescribe medications that are used to help prevent clots, such as heparin or Lovenox. You might hear someone call them blood thinners or anticoagulants.